I'm a California licensed naturopathic doctor, and I want to talk a little bit about what naturopathic doctors are, because I think a lot of people don't know. And so I'd like to use this as a little bit of time where we can do some education around that. Naturopathic doctors, we are primary care doctors. So we attend 4-year medical programs. They are specific naturopathic medical programs. Each state has different licensure scope. In California, we are allowed to order tests like an MD or DO can, and typically all naturopathic doctors practice slightly differently, but typically we use a lot of conventional diagnostic tests, just like all standard blood work and imaging, and then also use a lot of what are called alternative type tests, like sometimes things like functional stool tests or nutrient panels on blood to just help get a larger picture of a person's baseline health. Naturopathic doctors are very wellness oriented in how they practice. So it's a little bit about how we practice. The designation ND is naturopathic doctor. So when you see MD or DO, medical doctor, osteopathic doctor, ND is what a naturopathic doctor's official designation is. So NDs will typically integrate conventional medicine diagnostics with natural medicine treatments. We do refer out to specialists. We do sometimes prescribe pharmaceuticals if absolutely necessary, but our first intention is to always treat with the most non-invasive medicines possible. So a really important point about naturopathic doctor training philosophically is we're always taught that the body really has the innate ability to heal, so that our natural function is health and wellness. And so if something doesn't look like that, we really need to be asking why. The body should always be able to return to a state of health. And so these things that we're going to talk about tonight, we're going to talk about food and lifestyle practices first that help maintain that, and then these supplements are things that can really enhance that. But if the body is having difficulty healing or thriving, then we really want to ask why and what's going on, because the body should be able to maintain health at all times. So naturopathic medical programs are 4-year postgraduate, similar to an MD or DO program, and in the first 2 years, we learn basic sciences, and we take basic science board exams after that period. And then our 3rd and 4th years, our clinical focus is on both conventional medicine and natural medicine practices. And then we take a set of clinical board exams, and then we apply for licensure in whichever state we're interested in practicing in. Natural medicine can be very effective, not only for prevention, but also for chronic debilitating illnesses. Most of my practice is actually chronic illness. I think that, we have kind of this generalization that happens, or an assumption that happens, that these types of things are really great for prevention, but when you get really sick, you need drugs and surgery, and that's the only thing that's really going to take care of it. And sometimes there are cases where drugs and surgery are very appropriate. But a lot of the times, a lot of the diseases that we're struggling with in our society are really due to chronic lifestyle choices that are not promoting our health. And so really just wanting to do the education piece about that, because there's a lot of really great supplements to talk about, and I want to give you guys those tidbits in terms of which supplements really help to maintain wellness. But that's really the icing on the cake. The real cake, so to speak, is what you do every day in terms of your lifestyle practices.